Greetings, Richard. Hi there.
Hi,
You?
I remembered and I'm on time for once.
I know, right? I know you've tried a number of times to join. I believe we have a few more folks that are going to be joining us tonight. Oh, Amy's with us. Hi, Amy. Glad you could make it. Excellent. All right. Well, we are recording it so that we can share it with other folks that cannot be with us this evening. But I am excited about this topic. And, it affects so many people. It really does. So it's actually one of the most popular topics that we have. All right, I'm just going to do one more little tweak to my PowerPoint here, and then we'll be ready to go.
Hi, Dr. Heather. I'm muted because my cat's just meowing the whole time. So
Okay, I understand. No
Yeah.
worries. I get it. Let me just see here. There we go. Okay, great. Excellent. All right, well, we're just going to jump right in because I have a lot of material I want to cover tonight, and I want to keep everybody on time. So this is part of our ongoing body signals series, and we just do a different condition each month so that we can cover lots of different things. This is what I think of as the continuing education for the practice. So when I go off to seminars and workshops and conferences, this is the way I can bring back everything that I learn and share it with all of you. So this is your continuing education as well. This is how you can stay on top of everything. And, this topic is a big one here. A lot of people in the last couple of years have noticed even more low back pain because of working from home and remotely. And in the beginning of the pandemic, a few years ago, people were either at home working and sitting too much, or they were at home sitting and not working enough, because a lot of people had big changes with their careers. And then that adds a whole level of stress as well. And we'll see how stress plays out through all of this too. Next month, we are going to be, just a little bit of housekeeping, we are going to be doing a webinar on how to get 15 pounds healthier in 15 weeks. So that also is another very popular workshop. So just watch for our emails on that when that comes out. And, we don't cover just, the same old rigmarole that you hear everywhere. No, what we're covering is what the cutting edge is, what we're learning, what the science shows us is the cutting edge, and how we get results right here in the practice. So if you know anybody that struggles with that, and we call it getting 15 pounds healthier in 15 weeks. So it's not about losing weight, it's about getting 15 pounds healthier. So I have some people that are trying to gain weight, they're trying to gain muscle and that kind of thing. So it would be for them as well. All right, so when it comes to, let's just go right now to my PowerPoint so that I can, I'm going to just set it up for the slideshow. All right, that is ready to go. And let me just do a little screen share here so you can see what I'm looking at. And Shaylin, you're able to join us. Yay. Thank you so much. And Sue is here too. All right. So once I put my PowerPoint on, I can no longer see the chat or see you guys. So at different times, I'm gonna pop out so that I can see. Feel free to put things in the chat, but I may not answer it right away, but I'll check on it now and then, okay? And then also I like to keep this engaged as well. So there'll be times when I'll ask questions. So I want you to unmute and just participate and answer the questions, and we'll have a little dialogue at different times, but everything to still just keep us right on time as well. So I'm sensitive to that. But we are gonna go, we sometimes do go over the hour for this particular one because it's such a good topic. All right, so let's see. There we go. We're ready to jump in. And now I'm just gonna set this up so I do have my slideshow playing. And we're good to go. All right. So we have a rule of 15 when it comes to bulletproofing your low back and or on your way towards bulletproofing your low back. And this rule of 15 especially comes into play when you are either shoveling snow, which was last week, or in the garden, which is this week, right? And so it's a whole process where you're going to warm up, kind of like when you warm up before you go for a walk or a jog or like getting ready to exercise. So you're going to do a little warm up for 15 minutes. Then you're going to shovel and garden for 15 minutes. Then you're going to go put ice on your back for 15 minutes. And then you're going to go shovel again for 15 minutes. Or you could find a 15-year-old and pay them $15 to do the work. That's my rule of 15. Okay.
You find them, I'll pay them.
Okay, yeah, fair enough, fair enough. So this is one of the most popular topics, and of course, it's so timely for right now. It is the most common thing I see in my practice, and in spite of how immune system function has taken a lot of interest in the last couple of years, still the number one burden, healthcare burden to our society is low back pain, and it actually is the single biggest financial burden in healthcare is low back pain. And I find that there are two types of people that like to attend this webinar. There are the folks that have a little bit of discomfort or not at all, but they want to be proactive. That's probably about 15% of the people. But then there's the rest that have had back problems for a while and they want to finally address it and they're tired of it causing problems. So I can just think of a few folks in my practice. Shaylin, you're not the first one in the category of pregnant women that are struggling with low back pain because all the changes that happen with the body. But I've had some patients that are pregnant women that before they got pregnant, they were having low back trouble. Then they got pregnant and it changed dramatically, but it was still bad. And then they give birth and then they have a whole nother other thing. And then they come in for chiropractic care, right? So, but I hear the history of how it all evolves. I had a patient today who their back pain started with pregnancy, decades ago. So we know that this is oftentimes a thing that has to do with the joints, with the ligaments and so on. But then we also have folks that are occupational athletes, I call them. So there are people that are using their body as part of their work. So not like a professional athlete where, just need your body good for 5 years and then you made your money and you can retire. No, these are folks that need their bodies to work for their whole life, right? And then there are the desk jockeys that are struggling with low back pain, the ones that are sniffing the monitor all day long, that are sitting. It's the sedentariness that is just taking them out. And then we have the whole range. We have, the folks that are in their, 20s and they just, injure from a trauma from snowboarding or sports injuries or that kind of thing. Then they hit their 30s and now it's kind of like, oh yeah, now and then I'm getting this thing and I'm tweaking my back and it's not from a big trauma or injury. And then they're in their 40s and they're starting to, kind of feel like they're a little achy, maybe I'm just getting old. And, and then they're in their 50s and their back is going out more often than they're going out, right? And now next thing you know, they're starting to get into their 60s and it's now become constant for them. And it's just this process that evolves over time. And of course, part of that mix is people that have, struggled with car accidents and where there have been real traumas that have been involved. So it kind of crosses the whole spectrum there. But the research shows that when you look at what are you going to do about it, that's actually where the eventual outcome is going to play out in different trajectories. So people that oftentimes I'll have people that'll come in and they're getting better and then they're feeling okay. And the next thing you know, they start to do too much and they go and they have a party weekend or something and they blow out a disc and, next thing you know, they're going for surgery when we were covering ground, but they didn't really follow all the recommendations the same way that they should have. So surgery oftentimes is a route that people go down, and it's one that we really want to try to prevent people from going down. They actually had a study. Research shows that folks who consult with MDs with acute low back pain, 20% end up getting operated on. But if you consult with a chiropractor first, only 5% get operated on. And in my office, I've probably helped over 10,000 people get their health back over the last, over 30 years, coming up on 40 years. In my office, my stats show that in the 38 years now, I've had 2 cases that needed to go for surgery after being under care with me. And they both had waited before coming in to see me until it was already chronic. But that would put my stats at less than 1%. So it really does pay off to get regular care and prevent having to go down the surgery route. So today, I want to show you what are the most important things that research shows that we need to do to avoid going down that surgery route, and also to avoid degenerating the spine over time. And also, even more importantly, how to take the best care of our spines so that our spines last us our entire life, an entire lifetime, because that's really what they were designed to do. How do we bulletproof our low back so we can not just avoid pain, but because pain may be needed, your body may need pain in your low back at times. So it's not that we're going to be avoiding pain, but it's that, and the pain can be there to protect you as well. And so pain is just a part of life in some ways, but more importantly, if you do get some body signal where your back is talking to you, giving you pain, right? How do you recover as fast as possible? And how do you prevent long-term breakdown? And how do you have your back in top condition, doing all the things that you love to do in your life so that you can live the life that you want on your own terms? That's what we mean by bulletproofing. So bulletproofing doesn't mean that a bullet never comes at you. It means that when it does, that you're recovering from it and you're preventing long-term damage from it. Okay, is that fair enough? So as we age, we should get better and we should stay in top condition and not decline. And we should not stop doing the things we love just because we're aging. I mean, you should go into your 80s and 90s and still have great function and great quality of life. So how do we avoid having to go down the surgery route? Well, let's start by reviewing how low back concerns show up in my office. So this is kind of the way they show up. Folks show up with low back pain, tight muscles. They lose range of motion in their spine. They have stiffness. Sometimes they have pain going into their legs. They might have swelling or burning or numbness. Those are all the ways that it kind of shows up. And I gave you some examples of, busy moms and athletes and contractors, those are the occupational athletes and desk jockeys. So what I want you to know is it's incredibly widespread. It affects almost every age, both male and female. And what they all have in common is it derails life. It derails fun, fitness, productivity, sleep, energy, everything. And as ubiquitous as it is, what bothers me the most is that it's pretty much almost totally preventable. And it's absolutely correctable, but to correct the problem, you have to understand the cause. And that's where I want to go now. I want to unpack this a bit so that you can understand, when you have all these kinds of symptoms, what do they mean? What are they trying to tell you so that you can then make the best decisions for yourself? So we're going to go through a little anatomy lesson here. And then when you understand it, you'll be able to take better care of yourself, make smarter decisions. And so let's just look at this suit of armor that protects our spine. We're going to focus on that low back area. And that's going to help you understand the best strategy to bulletproof your low back. So when we look at the low back, it's comprised of the pelvis, which is the hips here that you see. So we're looking at someone's pelvis from the front. So these are the ischial tuberosities, your sit bones right down here. This is the pelvic brim that comes around, the symphysis pubis right in the front of your lower abdomen, your lower belly, the bottom of your belly. These are your hip joints on either side the ilium. This is where the leg bones come in. So these are actually hip joints here and here. And then here's the sacrum, this triangular bone at the bottom of the spine. So this joint right here is the junction between the sacrum and the ilium. So it's called the sacroiliac joint. And then stacked up on top of the sacrum is the lumbar vertebrae. So there's L5, L4. In between those vertebrae are the discs that you see here. And then these bones are called the transverse processes. So the bones have all these unique shapes to them because that's where the muscles and the ligaments attach to act as levers to be able to move the bones around. In my practice, I find a lot of low back pain is caused by an instability of the sacroiliac joints. So if you recognize this, all the weight of the body is coming right down and sitting right on top of this sacrum. And these joints are very complex joints here. They're kind of like sitting like almost like a sling. So the pelvis is like this, the sacrum sits right here, and then all of the lumbar vertebrae are stacked up on top. And so the sacrum sits right here in the sling of the pelvis. And when you breathe or walk, that sacrum goes back and forth, back and forth. And that's what's supposed to happen with these joints. And that's where the rest of the spine now has a gentle wave-like motion when you're walking or breathing. And the body loves that if we can go back and forth. There are ligaments that crisscross this joint here, and ligaments on the back and on the front that crisscross the joint. And if the sacroiliac gets misaligned, it stresses the ligaments here. And when these ligaments get stressed or strained, the muscles are going to tighten up here in the lumbar spine, because now the foundation of the sacrum gets unstable. So instead of going back and forth, it starts to go side to side. You know, if you have a sprain in a joint and all the weight of the body is sitting on top of that sacrum, your brain is going to say, whoa, I don't think we want weight on that sprained joint. So let's move the weight over to the other side. And when you move it to the other side, that other side of the joint, then the brain's saying, hang on, wait, it's not supposed to be on one side, it's supposed to be in the middle, but not on that where it's sprained, but not there, it should be in the middle. And so now you have the sacrum going back and forth instead of going forwards and back. And when it goes from side to side, that creates chaos in the rest of the spine. And so since the foundation is unstable because of that, the muscles above that will spasm. And when they spasm, sometimes that's the cause of pain, is the spasming in the muscles, more so even than the sprain of the ligament or the injury to the sacroiliac joints. So that tightening of the muscles can wreak havoc above the sacroiliac. And this then, when these muscles right above the sacrum that are all involved with the lumbar spine, when they spasm, they tighten down, they start to compress that disc. And now that disc is at risk for bulging, herniating, or rupturing. So oftentimes I find the sacroiliac instability precedes the later on what's coming is a disc problem because of long-term chronic sacroiliac instability. The sacroiliac instabilities are functional, which means that you can't like look at an x-ray and see them. It's the way the joint is moving rather than anything to do with the shape of the bones or of the sacrum or the pelvis. So you can't necessarily take an x-ray and see a sacroiliac instability. It's more a function. And that's why we do our testing in the exam and in the adjusting room, doing a test whether or not that sacroiliac is unstable. It's a very complex joint, and when it isn't aligned, it creates stress all around it, even down into the knees and the hips, and all the way up into the shoulders, the jaw, and the low back. So it's not uncommon when someone has a sacroiliac instability that they'll also may complain of some jaw trouble as well, I find. Okay, let's go up from the sacroiliac and look at the lumbar spine. So this is looking at the lumbar spine from the side here. You can see it. And so here are the big blocks of bones of the vertebral bodies. Here are the discs in between the bones. And then this is where the spinal cord runs behind those blocks of bone through this canal right here. And then all of these holes in between the bones, that's where the nerve roots come out. And those nerves are carrying the messages out to the body. So a lot of these nerves will come out and then they'll join together to form one big sciatic nerve, which goes right down your leg. So when people talk about sciatic pain or sciatica, it's because they have pain going down into the leg and it's coming from the sciatic nerve, which has impingement on it up here in the lumbar spine. All right, so the bones of the spine, as I said, they are shaped the way they are in very unusual ways because the muscles and the ligaments that attach to them allow certain types of movement. And so that movement ambulation, when you're walking and moving, there's a certain way the lumbar spine is going to move. And a muscle's job primarily is to move the bone. And so if we are going to walk, if we're going to bend over, any movement we're going to have, we need the muscles moving those bones by contracting and releasing. And so the brain is coordinating all that. And when you think of, bending your finger, it's the muscle that's moving those bones, right? So the muscles, the muscular attachment is for movement and ambulation, but it's also for protection. It's for protection of the nervous system. And so when we walk through all this anatomy, I want you to think of the muscles as, movers, but also if you have any kind of misalignment in this vertebra that's putting any irritation on this nerve, then you don't want to be moving that joint, because more movement of that joint is going to irritate that nerve more and more. So the secondary role of the muscles is to strap that joint down and stop it from moving. And that's where it will be protecting the nervous system when it does that. We probably would have a better protection of our spinal cord and our nerve roots if this was just one solid tube of bone that didn't move at all. But then it would be really hard to move our bodies around. We wouldn't have that flexibility and that dynamic movement that we have that allows us to run and to bend and all of that. So we may not survive as a species if we can't hunt and run and capture prey and harvest and all of that. So we have a beautiful design that not only has the bony protection to it, but it also has joints that allows movement. And that is the awesome design that we have here. So I want you to recognize that certain areas of the body are more prone to problems than others. Anybody here ever have a cavity? Where is the most common place for cavities to happen? In the back, right? And any dentist will tell you that, it's not the front teeth, it's the back teeth that tend to have the cavities, right? And that they're more prone to get cavities. Well, the spine is the same, that the lumbar vertebrae are more prone to take the brunt of the load from the rest of the spine. And so this L5, actually this is L5 here, so just below it, the L5S1 disc, that takes the most load, and that's the disc over time that deflates and decreases and can even bulge. It's the most common one to degenerate over time. And if you are, when we're pushing on the nerves that can affect when this vertebra misaligns, it can push on the nerves that then affect the legs where the sciatic nerve goes down, but also the nerves that come out of the lumbar spine go to certain organs. And so it can affect those organ functions as well. I want to show you what a disc herniation is like. So the disc, it actually is kind of like a jelly donut. It has these fibers all around the outside, and then the inside has this more gel-like substance. And the purpose of this is that we want to have proper movement of that joint, and that joint kind of rotates around, and it rotates around that jelly-like center. So I don't know if you've ever sat on a wobble seat. I'm sitting on a really great ergonomic chair right now that I'm going to show you actually at one point during our presentation, because I love these chairs. But this chair actually has a lot of movement to it. So it allows me to go in a circle. And when I go in a circle like this, it actually is fantastic for my discs, for the health of my discs. Now, when a disc has too much pressure on it, it actually can bulge out. And when it bulges enough, these fibers can lose integrity, which is what holds that jelly-like substance in. And at first it's going to bulge and just push out, and that can push against the nerve and compress the nerve, which can cause trouble. It can push against the spinal cord as well, which can also cause a lot of trouble. That disc bulge can then, if these fibers lose integrity, that bulge can actually turn into a herniation and even a rupture, where some of that disc material can come out into this intervertebral space, the intervertebral foraminal space, and it can even break off and float around in there. And that's really tricky when that happens. The damage that happens when a disc is damaged, it actually creates an inflammation, and then the inflammation creates an irritation. So We call this a motor unit. A motor unit, motor meaning motion. A motor unit means motion of the joint, where you're going to have two joints. Where's my pointer? Here it is. We're going to have two joints with a disc in it. And this is another part of the joint here. This is where the top and the bottom bones intersect and move. We have the nerves as part of that motor unit, right? And then what we don't see on here is the muscles are part of that motor unit that move that joint. And then we have fascia and we have fatty tissue. And of course, there's blood vessels and all kinds of other things, all part of the motor unit. When we have any damage done, it's going to bring about inflammation. The inflammation also is going to secrete chemicals that will irritate this area and can irritate the nerve as well. And so that's when the muscles are going to splint that, or we're going to strap that joint down to try to stop that irritation on that inflamed nerve. And then if these nerves, I was just checking my notes, if these nerves are going down into the leg, this can actually cause pain all the way down into the leg. If this is the nerve that is carrying the messages to the bladder or the bowels or the reproductive organs, then we could have dysfunction in those organs as well as a result of this nerve interference. Then over time, if this persists, you start to get arthritis and degenerative changes and what are called osteophytes or candle dripping that can impinge on the nerves in the spinal cord. When we have the degenerative change that makes this hole smaller and smaller, or makes this hole where the spinal cord is running smaller and smaller because of the bony outgrowths, that's called stenosis. And then it's really important to do everything you can to slow it down and if possible, stabilize and stop it. So I'm going to now just show you a couple more things, and then I'm going to stop my screen share so I can pull out the spine and show you a few things there as well. This next chart shows the fibers in the disc. So this is again looking at just the disc without it being attached to the bones on the top and the bottom. Here are these annulus fibers that are the circles around it. Here's the nucleus pulposus, which is that jelly-like substance in the middle. Now I want you to look closely at all these striated layers. These are layers of fibers. And if you look closely, you'll see that each layer, the striations go in a different direction. Some are going like this, and then the next layer, it goes like this, and the next layer is like this. And so one of the things that can happen in this sheet here is that you can actually have these fibers separate. And when they separate, the disc material can come through that separation. So it's not a breaking of fibers, it's a separating of fibers. So sometimes when people have disc problems, it's not a wearing down and breaking of the fibers, it's a separation of the fibers. And there was a fantastic study that was done actually on cadavers, which of course are, the dead bodies, where this was at the Bethesda Naval Hospital. And they showed that if you remove the downward pressure on the disc and you twist and untwist that motor unit, those fibers can actually return to their normal position and the disc material can be sucked back in. And so when I am working with people that it looks like they've got some disc trouble, I know that before I even put my hands on them, there's one of two outcomes here. Either they've got these striated, separated disc herniation, in which case we're going to expect a pretty quick recovery, or they've got those fibers that have broken down, and that's going to be a longer road to recovery. And sometimes I don't know what's happening because I'm not a surgeon going in and looking at that. I'm watching what's happening with the function. And so if we see that there is a pretty quick recovery, we can kind of assume that what's happening in this case is there was a separation. And if we take that pressure off of the spine, off of the disc, and we add some movement into it, that those striated layers can correct themselves and that disc can suck itself back in. Now, I just wanted to show you that's the sciatic nerve as well here. The sciatic nerve is when it gets irritated here, it can cause pain, numbness, and tingling all the way down into your buttocks, your legs, and your feet. This is the sciatic nerve. Now, what else can happen is you can have this sacroiliac joint here where you have the ligaments that cross it. And then on top of that, you have muscles. You've got your gluteus muscles, you've got your piriformis muscles. And if those muscles, if the brain tells those muscles to spasm, to try and lock down this sacroiliac joint in the pelvic area, that spasm can actually put some pressure on the nerve as well as the sciatic nerve. And that can start to interfere with the flow of messages, and that can cause pain too. So it's quite a dynamic and complex area here that is all involved with sciatica. Sometimes sciatica can be from the disc herniation, sometimes it can be from the sacroiliac instability, and sometimes it can be from the piriformis and the muscle spasming. But what I want you to know is that when you have sciatica leg pain, it's called a radiculopathy, and it's not a leg problem, it's a back problem, it's a spine problem, and it's a disc and a nerve problem. So that's what sciatica is. Now, when we look at lateral lumbar x-rays and MRIs, we can get a good look at the anatomy here. So an x-ray, a healthy normal x-ray of the low back, is going to have a beautiful forward curve. And these are all the blocks of vertebrae. Here's the disc spaces in between. And then this is the canal where the spinal cord runs. And then these holes are where the nerve roots will come out to carry the messages into the legs, to the sciatic nerve, but also to the organs. At the very back of all this stack of lumbar vertebral bodies, we want this to be a nice, fluid, smooth curve. And we want everything to be lined up in this curve. Sometimes you can have subluxations where the vertebrae will be coming back too far. So you see that this is where the curve should be. This person has a straightening, a loss of that curve, and they have these vertebrae that have gone back. And you can see it's not even a smooth line, it's set back. And this is right where the nerve comes out from between the bones. So you can see the subluxation or the misalignment of the vertebrae is going to start to create some interference in the flow of messages here. I don't know if you can see it that well, but if you look at the size of this disc and the size of this disc, and now you look at the size of this one, it's much narrower. And if you look at the whiteness that's right here, that's degenerative change. You can see some little bone spurs actually right here. There's a bone spur. And so those are all signs of degenerative change. This disc also is very, very degenerated, and this disc is almost gone down here with lots of spurring here. Now, if we look at an MRI is kind of like we're taking a slice right down the middle of the body, and we can see this is the spinal cord running through here. Here are the vertebral bodies on this side. And then here are the joints that stick out on the back of the spinous processes, the transverse, they call it the lamina, the mammillary bodies, that kind of thing. That's all this part. And so this is where the spinal cord runs. And again, this should be a very smooth line right here. But what's happening right here? That disc is bulging right into the spinal cord space. And you can see this bulge right here, much larger bulge. Do you see that right there? So that's what it looks like. And sometimes people refer to this as a slipped disc, or a disc herniation is another word that's used for it. So one thing that I find is really fascinating is, here we have healthy normal, and then we see on the plain film that's not normal. And then we see on the MRI, actually what's happening to the soft tissue with the discs and so on, right? What I find is fascinating is they have studies that show that if you took x-rays of people and even MRIs of people, and you showed the MRI to a radiologist, it's going to read the film, and if they don't know what the symptoms are, they're only looking at what they're seeing here, 50% of the people that would show a disc herniation just like this have no pain. 50% have no pain. And 50% of the people that have all of the symptoms of a disc herniation, when they go and look at the MRI, the radiologist says, nope, healthy there. There's no disc herniations there, right? So you can't trust just what an image shows us. We have to couple it with our other tests. And our other tests, as well as the symptoms that person, the body signals that person is getting. So again, we have to take the imaging and we have to integrate it with our other methods of analysis. All right, so before we go further, I want to show you what I lovingly refer to as my sushi bar here. So let me pull this up here. I'm going to stop our screen share here. And I hope that since I'm speaking, I'm the biggest screen that you're looking at here rather than looking at other folks here. This is an example of the healthy normal joint of a lumbar disc. So this is a lumbar vertebra that we're looking at here. I just want to get myself set up here. There we go. All right, so this is a healthy lumbar vertebral unit. This is looking at it from the front, where we see the big blocks of bone. We see the beautiful disc here. This is looking at it from the side, where we see the spinous processes. Those are the bumps you can feel on your back sticking out. And then the transverse processes here sticking out, right? So this is what all the muscles and ligaments are attached to, so that it can act as a lever to move that joint. And of course, we see the nerves coming out through that the IVF, the intervertebral foramina, right? All right, so when we see that healthy vertebral unit, you can see the edges of the bones are all nice and smooth here. Everything is in good shape. Disc is healthy, nerve is robust and healthy, everything's in alignment. If we misalign the vertebrae and if the muscles are spasming and strapping down this joint, we can see compression on this nerve. I'm going to put them side by side. You see how this is a nice big healthy disc, and this one is a compressed disc. And when it gets compressed, right, the nucleus pulposus, this disc is inflamed. And when it gets inflamed, it's going to, it can start to put irritation on the nerve here, right? So it's not a bulging disc at this point. It's not a herniated disc at this point, but it is compressed, and that disc has to go somewhere if you squeeze on it. And so it's moving in this direction in this case, and it can move out in all of these directions. One other thing I want to mention is that the discs do not have a lot of blood supply. They don't have a lot of blood vessels going in and out of there. So the way that we get nutrients to our body oftentimes is using blood supply. The way that we get toxins out of tissues is using blood supply. But the disc doesn't have a good blood supply. So it has to get its nutrients in and its toxins out some other way. Now, if you were to take a sponge and you squeeze that sponge, the water comes out. And when you release it, if you put it on water, it's going to suck the water back in. So the disc actually gets its nutrients in and its toxins out through movement. So when we move our spine and move the disc, that's when we're going to be squishing and releasing, squishing and releasing. And that's exactly what the disc needs all the time to stay healthy. If you have a misalignment of subluxation and you're irritating the nerve and those muscles spasm and they don't release, now they've strapped the joint down trying to protect the nerves. But when they strap that joint down, the disc stops getting toxins out and stops getting nutrients in. And we call that a loss of imbibition. Imbibition is like that sponge action of getting fluid in and out. So that's a really important thing to understand about the health of a disc, is it needs movement in order to stay healthy. And so we see this compressed disc now, which is now not in a good shape for over time, because that disc is going to start to deteriorate if it doesn't get toxins out and nutrients in. And so we see, one other thing I'll point out here is the edges of the vertebra are starting to get roughened when we have misalignments of the vertebrae. And that roughening is being caused because the ligaments on either side of the bone here that we don't see ligaments here, but they are attached to the bones. And so those ligaments that would be stretching from one vertebra to the next help to hold the integrity of the disc. But if you compress that disc, those ligaments are getting tugged on, and that tug on the bone is going to make that bone respond to the tug. And the bone is living tissue, so it is going to respond to stress. And if there's a tug on the bone, it's going to grow bone there because you have more demand on that bone there. So your smart body is going to say, oh, more demand on the bone there. we better grow bone there. And so over time, we start to see these osteophytes. And the osteophytes are following exactly where the ligaments are attached and the ligaments that got stretched. And as they, oh, sorry, let's take it one step back. These got put on in different order. Right, so we see the beginnings of these osteophytes here. And we also see what a disc looks like when it herniates. And if it herniates right into that IVF, like you see right here, you can see how it could be putting pressure on the nerve. Now, I also want you to notice over time, this takes time to happen. We see the bone spurs growing, but what do we see happening to the nerves? What is happening to the size of these nerves, right? We got this healthier nerve here. And look at this one, how it's getting scrawny and worn down, and it's getting less robust. And so chronically, you know that if you have degenerative change in the bones, you're going to have this kind of wasting away here happening of the nerves. And if that's happening to the nerves, what do you think happens to the part of the body that those nerves are in charge of controlling, right? Those organs are going to start to look shriveled up as well and not function as well. And finally, over time, when you have this disc herniation that's happened, now you get to the point where this disc just gets all dried up. You know, you can hardly even see the disc here, and you can see the bone spurs have actually started to fuse these bones together. Look at these piddly little nerves here now, right? So scrawny. So when we see this happening, I just want you to appreciate that this is your smart body responding to chronic stress. This is the way it has to respond if you never take the stress off the system. It's your smart body because here you have a stable, healthy vertebral motor unit that's moving. Here you have one that isn't moving and it's become unstable. And so the muscles have strapped it down because of its instability. If we never correct this, over time, that instability leads to stability. Fusion of the vertebrae is stable. It's dysfunctionally stable, but it's stable. Whereas this is functionally stable because there's movement and it's lined up. Okay, so that's my sushi bar. And the reason I call it that is this is what, oops, that's what it looks like, right? On the black bar here. All right, so now that you have a clear understanding of what happens to the bones and the joints and the motor units, now when we go back to our screen share here, let's see, oh, Katie joined us and Janice joined us. Welcome to you. Thank you for joining. If you have comments, you can put them into the chat and I will come back and check it now and then. But once I put my PowerPoint up again, I don't always I can't check the chat at the same time. All right, so here we go with sharing my screen again. All right. So next, if we go back and review this, now you understand when there is low back pain and you have tight muscles, your smart body strapping those joints down, the loss of the range of motion leads to a loss of imbibition. And then we have the stiffness that comes with that. And now you understand why there's leg pain, why there's swelling and burning and numbness that can happen. And all of this, you know, a lot of people think, okay, well, you know, when does this kind of thing start? And I will tell you that just today I have a sophomore in high school that has disc herniation and early degenerative change already starting in his spine. So the research shows that 9% of 10-year-olds are already starting to have degenerative changes in their spine. Like, holy smokes, that's starting early now. And so again, when you're a teen, you're involved with your sports, you think you can get away with anything. But recognize that a lot of the activities of teenagers nowadays is hunched over on their phones and their devices. And that hunching is just putting so much pressure on that lumbar spine and that L5 disc. And so it's setting them up for earlier and earlier degenerative change. In their 20s, you know, they've just gone through 15 years of school and the sitting, you know, they've got all that behind them. And then they get into the 30s and they start to kind of get deconditioned. They're not as active. They're actually at the desk even more. And so there's actually less stability in the spine, but they still think that they can act on the weekends, and they still act like they're in their 20s when they're on the weekends, they're a weekend warrior. And so they kind of report that occasional tweak now and then, rather than the occasional stiffness and pain in the 20s when they just worked out too hard, or, they recovered fast. But now they have a tweak, and usually the answer they go to is heat and starting to pop pills. Then in the 40s, more sedentary, obesity starts to set in. They're overweight, they're deconditioned, they start to have degenerative changes underway, and the structure is weakening. And now their back goes out on them occasionally, but they just push through it, they ignore it, and usually use more pills to deal with it. And then in the 50s, right, as I said, their back goes out more than they do, and they're starting to live around their problems. They stop doing the things they love to do. They no longer exercise. They just pop the pills. They stifle their physiology, and they have to use stronger and stronger drugs, therapies, surgeries. And the whole opioid crisis, the gateway drug for the opioid crisis is treating low back pain. Like, that's the #1 gateway to the whole opioid addiction crisis, is treating low back pain. And then people get in their 60s, and now they have a liability of severe degeneration that's already happened. They have more weakness, their nervous system's compromised, more drugs and surgeries. We call this adult onset FAS, falling apart syndrome. So just, raise your hand if you recognize yourself anywhere in this process. And, I mentioned the whole mama scene as well. So I know we've got some moms out there too. So I just want you to see that this is a timeline struggling as we march through life, and it just develops into bigger and bigger low back issues. But there are other options out there. So what can we do besides chiropractic care? Let's look at the allopathic traditional medication or medical world. Let's just look at what that is, the allopathic options. And again, remember, this is what our culture is designed for and is teaching people, and is pretty much corralling people and moving them in this direction. So, you have trouble with your back. The first thing is heat and bed rest. So let's just unpack these things, because when we look at all these different options, we're going to look at some of the stats and what the research shows us on all this. But I actually just want to make sure I got my page in order here. Yes, totally do. All right, so the heat and bed rest, drugs, physical therapy, steroid injections, pain management, surgery, and then other alternatives to that. So remember that we have to differentiate what the objectives are for these different ways of addressing the body. The allopathic mode is using drugs and surgery, and it's to treat the symptom. That is the purpose of the allopathic model, or the medical model, is to treat the symptom. And so I have patients that'll come in and they'll ask me, hey doc, I got this low back pain. Should I take these drugs? And again, it just comes back to, well, what's your objective, right? So I don't know the answer to that question, because I have to understand what is your objective. And once you understand your body and how to take better care of it, then your questions may change. But I want you to just understand that if your objective, what are you trying to accomplish? Is it just symptom relief? If that's the only thing that you're trying to accomplish is, I just want these symptoms to go away, then the drugs might make sense if that's all you want. But if you're understanding that the pain is the sign of a problem and it's a warning sign for you, what would a successful outcome look like to you? Would it be just to not have the pain, or would it be to be able to get back to your life? So just cover up the symptoms or get back into full function. And so then we have to ask the question, well, what is causing it, and is it correctable? So the medications don't have to ask that question of what's causing it and is it correctable. The medications just ask, can we stop that pain or not? So knowing what your goal is and what a successful outcome would be is important. And so a better question to ask, instead of should I take these drugs, a better question is, what is the safety and efficacy of whatever option I'm looking at? Everyone should be asking this. And what does the research show, both short-term and long-term? So if you're choosing drugs, what can we expect the outcome to be if we do go with the drugs? Let's take a look at that. How bad is it? 80% of Americans will experience back pain. 35% have low back pain at any given time. That's 1 in 3. If you think of all the people you know, 1 in 3 of them right now is struggling with low back pain. The incidence is up. In 1997, it was about 29%. It's up to 34%. I think in the last 2 years, I haven't seen the recent data, but I bet it's even higher than that with all the sedentariness that has played out here. It's actually more common in females. A third of females suffer. 31% of men report that it affects their work, but only 20% of females. So even though females are struggling with it more, they're clearly tougher, is what that shows us. But 50% of women experience back pain when they're pregnant, 50%. And of the 54% of low back pain sufferers, 54% are desk workers. Sitting is the new smoking, right? So everybody, if you don't have your video showing, I want you to know that at the bottom of your screen, you can use the little raise your hand icons and that kind of thing, right? So I would like everybody raise your hand, either with your actual hand if you've got your video on, if you know you sit too much. Raise your hand. Yeah, exactly. It's happening to all of us. I'm going to raise my hand there too. And that is what leads to major deconditioning, causing major back problems. So when we look at what the cost is, $50 billion is what it costs us in direct cost, $100 billion in indirect cost. And by indirect cost, what do I mean by that? Well, things like what we call presenteeism. This is when people are still showing up for a job. They're not absent, they're in their job, but they have so much pain or they're so drugged out that they're actually not very productive. We call that presenteeism. And that has a cost to it as well, that loss of productivity. And it's only trending upward in all these costs in our country. So the life effect, it is real how it affects all these people. And it just is, you can see as it starts a downward spiral of missing work, losing money, productivity and jobs, stopping exercising and stopping their active lifestyle, that downward spiral, just living around the problem, stopping doing the things that they love to do, right? It's all of these things, oh, I used to do this, but now I don't do that anymore. Yeah, I used to do landscaping, I used to do gardening, I used to ski, but now I just stay in the lodge. It's safer for me there, right? So people that are just living around it. But it can get much worse than that. The real pain and suffering, the acute pain, the chronic issues, and that can lead to the drug use, first popping the over-the-counter medications, then the prescription painkillers, then next thing you know, they're being cut off from the prescription painkillers that they're addicted to. Next thing you know, they're out on the street trying to get their street drugs. And as they run out and get shut off, they then go from illegal prescription drugs, very expensive, and then they go to heroin, which is in the opioid family, but it's 1/10 the cost. It's cheaper. So, I don't know about you, but I have people in my family that have been impacted by this, that have had these opioid addictions. And I actually have a cousin. She had chronic back pain and she had a family, and she would use these morphine patches. She would put the patches, and the idea was you put a patch on and it's like slowly goes into your system. And then you take that one off and you put another one on in a different place. That was the way it was supposed to work. And one day, her little 12-year-old girl wakes up in the bed, sleeping together with mama, wakes up and mama's dead because she forgot to take one of the patches off and put another one on. So she had a morphine overdose, killed her. But, she was primed for that. She was stuck in a cycle of using these opioid drugs, and, that's it, right? So it affects so many of us, and it's affected me in my family as well. So when we look at our healthcare crisis, are we using more and more medication or less? Let's look at what the studies show us, and especially the painkillers. It's literally going through the roof. Check it out. This is our nation's biggest health issue. I mean, COVID is a big thing that's taken the front stage, but in the background, this opioid issue has not gone away at all. And it's actually a conversation starting to come up about it now in the media, I'm noticing. So, maybe you've seen it. I don't know. Have you seen it on the media recently yourself? Vermont is a big place for the opioid crisis. I don't know if you're aware of that. So this is just showing, if we look at the increase in the legal narcotic production, so this is the legal drugs that we are using that are narcotics. And these are the prescription medications. And this goes from 2008 to 2016. It shows the trend. And sometimes it comes down a bit as far as the legal, like you can see right here, it looks like it's coming down. And again, this is the legal drugs, but I'll show you another study that shows that as this comes down, the street drugs go up. So the problem isn't going away. People are just being restricted more and it just gets transferred. So these are very powerful, highly addictive, prescription only, hardcore pain pills. You might recognize them: OxyContin, Percocet, Vicodin. They are the #1 selling drug class in America. And more than statin drugs, more than anti-anxiety medications. And how many people know people that are on statins and anti-anxiety drugs, right? But no one talks about the opioid addiction. No one's talking about that. And so, how prevalent is it? Well, this shows opioid prescriptions per 100 people. And this is an older study. This is from 2012. So I know that Vermont actually spiked a lot higher in the last few years. So this is not as accurate, but you can kind of see just the ranges. And I just want you to notice one thing here. This is a percentage of the population using opioid prescriptions, right? So, 50 to 60% of the population is using opioid prescriptions. But check this out. This number is going over 100. More than 100% of the population is using opioid. Like, how does that work? Every man, woman, and child, right? 1 for 1. This means it's going for more than one person, right? And look at the drug alley that's happening right in through here, right? Where it's just totally maxing out, like multiple opioid prescriptions per person. That is crazy. Look at this one here. 40 people a day are dying from narcotic prescription drug overdoses. And my cousin was in that realm. Enough painkillers to medicate every US adult around the clock for a month. There are consequences to this, right? Check this out. This is showing you how the blue is cocaine, the light blue is heroin, right? Street drugs. The cocaine is the dark blue, and the opioid analgesic, right? This is the one that is the prescription medication. So the prescription medication is going up and up and up and up and up. And then we see, oh, well, this is going down, but when this goes down, this is going up, right? So yeah, you can see how this is happening here, right? And you can see even as this is going up, even the heroin is going up here as well. This now is this is just, it's in the popular media. It's all over. And, we've got a health crisis. Clearly, we have a health crisis. And the #1 reason is we now have a drug culture instead of a healthcare system. Instead of a healthcare system, we have a drug culture. That's what's happening here. People are taught that drugs are the first and best choice for managing health. And you know what? In the last couple of years with COVID, the same narrative was playing out. The only conversation was about vaccines and then the drugs, remdesivir and so on. I didn't hear a lot of conversation about the importance of vitamin D and omega-3s and healthy lifestyle, right? We just don't hear it. The drumbeat is all about the drug culture. For every problem, there's a pill. For every pain, there's a drug. So, is there a place for drugs? Absolutely. But for long-term health, absolutely not. Who agrees with me? Hands up. Who is with me here, right? That we need a better way here. Who thinks we need a better way, right? So when we look at, all of these options here, let's go through them. Heat. Well, heat, which is a common thing, just go and have bed rest and put some heat on there and make it feel better. Well, inflammation, anytime there's tissue damage and we have an inflammatory problem, heat might relax the muscles, but it also is a vasodilator and it can actually increase chronic inflammation. So heat might increase chronic inflammation. What about bed rest? Well, bed rest is similar to when a joint is strapped down. Even if the joint isn't strapped down, if you just go to bed rest now, all of your discs are not moving when you're in bed rest. So all of those discs are going to lose some of that inhibition. So you'll also, with bed rest, you'll get muscle atrophy. Those muscles are just going to lose their strength. So it's a bad idea. Bed rest is a bad idea. Maybe after an initial acute 48 hours of rest, okay, you have an acute injury and you just lay down for a couple of days, okay. But after that, you just need to get up and move. And the inhibition is going to, if the inhibition is stopped, then you're going to be able to minimize the degenerative change. But if you don't, if that strapping down happens, then that degeneration is just going to get in the way where the nutrients are not getting in, the toxins are not getting out, and the atrophy, you're just going to have a downward spiral from this. So how about the drugs? Now, we've just kind of gone over the problem with the drugs. They cover up the symptoms, and the symptoms, remember, are body signals. They are alarms. They are warnings telling you to stop. So one study showed that just for pain relief alone, 58% of the people felt that drugs were effective, right? Just about half, a little bit more than half. 54% felt that chiropractic was effective for the pain relief itself. 48% felt PT was effective for the pain, just the pain. So, there's good results in all three of those. But again, what is the question that we're asking? Not only is it effective, but is it safe? It's so important to ask both of those questions of each of your choices. PT is excellent for treating soft tissues surrounding the problem, but we must address what the actual problem is, not just what's surrounding the problem. So remember that strapping down of that joint is happening because of the nerve irritation from the misalignment. And so it's a structural neurological problem where the motor unit and the damage and the derangement. So PT is helpful if it's recovery oriented and rehab oriented. But remember that as far as if there's a subluxation, right, the PT is looking at the soft tissues around it, whereas we want somebody to be coming in and looking at the alignment of that motor unit. Now, steroid injections is a very common one that we hear people talk about. It's a powerful anti-inflammatory, but it's also dangerous, and it can lead to long-term joint damage. These are aggressive, and also it's pain relief short-term, but it actually sets the joint up for long-term instability. So you're trading acute pain for chronic degenerative problems with long-term damage to the synovial joints and long-term instability and compromise of the stability and health of the joint. So it is a trade-off. Now, pain management. By the time we're getting to pain management, these folks are desperate. They're just not addressing the cause. And we still have to go back to what's the safety and efficacy of it. So if we look at what is the most conservative and at least equally effective and much safer than drugs and surgery, right? We want to look at cost effectiveness. We want to look at any adverse outcome risks. We want to look at addiction issues, right? How about surgery? Where does surgery show up here? So let's look at that one. Okay. Surgery is incredibly expensive and potentially dangerous. And so again, we always have to go back to safety and efficacy. So what does the research say? Actually it says that there must be a better way, because the research says spinal fusion surgery is limited when it's treating degenerative joint disease and low back pain. Although it increased from 1990 to 2001, but since 2001, it's starting to decrease again. So the higher spine surgery rates are associated with worse outcomes. The best outcomes in the US were when surgery rates were lowest in an area, and the worst were where surgery rates were highest in the area. There are some new spinal fusion techniques and device implants that actually increase the risk of nerve injury, blood loss, overall complications, operative times, repeat surgeries, and they do not result in improved disability or reoperation rates. So new and improved things are coming out, and they say new and improved, but then over time, when you actually look at the outcomes, they're actually not proving to be better than the options that people have already been trying. Let me just show you what this looks like here. So, when we look at this back surgery, we actually have the worst track record with back surgery. Replacing knees and hips, we're doing okay with those, but not so with the spine. You're going in, you're ripping someone's spine open, you're infusing or taking out discs, and all this right next to the delicate nerve tissue of the spinal cord. It is much more complex. It's extremely intrusive. By the time we get to surgery, it's considered the last option. In fact, in the 80s, the research showed 33% of disc bulges with sciatica had surgery. 10 years later, it was 65% of them had a relapse, and they called it failed back surgery syndrome. So then they reduced it. Now it's only about 7% instead of 33%. So again, the two most important questions, safety and efficacy. I don't know. Does this look like the best option here? I mean, how many people think there's got to be a better way here, right? So let's just now look at chiropractic and what does chiropractic show in its efficacy? So we know that people who get adjusted regularly, who understand their body and know how to look after their spine and the nervous system, they see amazing results. Look at this. This is a study that looked at 700, there were 70,000 member months here, over 700,000 visits over a 7-year period where people could choose to either have a medical doctor for their primary care physician or to have a chiropractor. And this was a Blue Cross Blue Shield of Illinois study. And they gave people the option, you can either choose a chiropractor or a medical doctor. And then they had 7 years that they followed this. And this is what they saw. The people that chose the chiropractor as their primary care physician had a decrease of 60% in hospital admissions. They had a decrease of 59% hospital days, a decrease of 62% outpatient surgeries and procedures, and a decrease of 85% pharmaceutical costs. Now, if they're not spending as much money on the pharmaceutical, if the money has dropped, right, it means that the usage has dropped. These people were saved from being victims of the opioid crisis. I hope you get that that's what these stats are telling us. And this is all when compared to conventional medical intervention. Pretty cool, right? And just as a side note for the pregnant mamas here on our call, in this study, they showed that 22% of pregnancies in the conventional model went to C-sections. In Illinois, in this area of Chicago, Illinois, 22% of all births were C-sections. But in this chiropractic group, over 7 years, there were 0 C-sections, 0, right? So it just tells you the health of that spine, of the pelvis and the sacrum and the lumbar vertebra and the nerves going to the uterus and the nerves going down into the legs. Like all of that was so much healthier. So that meant you had healthier births as a result of it. Pretty cool, right? All right. So again, when we come back to how things look, right? The symptoms are the warning signs from your body. They're what we call your body signals. They're communications from your body. They're begging for mercy. They're begging for you to stop doing something that's hurting you and hurting tissue. And they want you to start doing something that's good for you that you've not been doing. And sometimes the body whispers and sometimes it screams at you. And sometimes it just kicks you in the ass, right? Has anyone ever had that moment, 1 second you're fine. And the next you decide to like pick a wet towel up off the bathroom floor, or your car keys off the ground, or you're just bending over to brush your teeth, right? Or that mattress has to be flipped right now, right? And you decide, I'm just going to do it on my own, right? Anybody done that, right? And the next second, you're looking up at the ceiling, grasping your low back and looking for the sniper that just shot you. Like, where did that come from, right? Anybody been there before, right? Just suddenly grabs you, right? Well, what's life like after the next few days after that, right? So these are body signals. And so that's why we're looking at each one of them. You're going to end up with acute pain symptoms of a spasm. It's the job the usual job is to move the joint unless there's an injury. And now that those muscles, they need to strap that joint down to prevent further damage, to stop that full range of motion. So that is a pretty smart body. right? Hands up if you get how smart the body is, right? And even when that body is spasming those muscles, that's still your smart body, right? And when you lose the range of motion, you get that stiffness, you get inflammation, you get more stiffness, then you start getting pain down the leg because of the swelling and misalignment, you get burning, numbness, and these are the signals that then drive your behavior. Now, if you knew that these were actually just the tip of the iceberg, right? The symptoms are the tip of the iceberg, and they're a sign usually of a bigger problem underneath that's not being seen. So when the symptoms start to show up and we're hurting, you know, ask yourself, is that the whole problem right there? Or is it really just the tip of the iceberg? And, you know, I had someone come in today, they had a knee problem. That was their big thing, the knee problem. When we looked at their spine, we saw all kinds of trouble in their spine. So that knee problem was the tip of the iceberg, showing us where the other dysfunction was underneath the surface and the rest of the body. So the way that you think about symptoms is what drives your choices, and that's what drives your outcomes. So again, the symptom is the sign of a problem below the surface. And if you only worry about treating the symptoms at the top of the iceberg, you know, you chip away at that, you come back later, boom, it just gets bigger. So we need a better way. So let's review some concepts of where symptoms live in the illness wellness continuum. And so here's a very important piece right here, first of all. So when we look at the illness wellness continuum, right, we want to just recognize that, you know, if we talk about symptoms, where do symptoms fall in this illness wellness continuum? So, you know, at one end, we have perfect health. And at the other end, you know, and when we talk about perfect health, loving how you look, how you feel, how you function, like life is good here, right? Then we get the other end of it, dead, right? That's the other end of this, death and perfect health. But there's this whole range in between. And nobody that is watching this webinar right now is not found somewhere on this continuum. Everybody's going to be somewhere on this continuum. And so the neutral point right here is where there's no symptoms or anything that you could like put a label on. That's what this place is right here. So no discernible illness or wellness, right? So notice that the signs here show up first as you're losing function, then the symptoms, then the disability. So when you think of a sign is something we can measure. A sign is something we can measure. It's not necessarily something we feel, but it's something that can be measured. Kind of like your blood pressure. Your blood pressure is a sign, but you don't necessarily feel what's happening with your blood pressure. So the signs of losing function, the signs will show up first as you're losing function. The symptoms come after the signs. The symptoms are when you're feeling something, right? So I want you to just understand the discernment between those two. Now, once the symptoms show up, if we still don't get correction, and we lose function more and more, now we're getting into disability. And disability is where you can't correct the symptoms anymore. That's a disability. So it goes signs, symptoms, disability. And it's no longer correctable. It's some sort of permanent injury. And the other way, starting from this neutral point, first, it starts with awareness. You have to be aware that there's more to this. And then after awareness, there's education. You literally have to train and learn because our culture is not just training you automatically. We have to go and seek out this education. And that then goes into robust health for the long term, where we grow right into that. Now, the problem is, when is it that we usually start to look for help? When do we start to look for help? Symptoms, right? Not until we hit symptoms do we start saying, whoa, something's wrong. I got to do something about this. And look how far down you are on this continuum here, right? You try that with a car and see how that goes, right? Wait until this car is giving you symptoms, right? You're already in trouble there, right? So how do we best measure the signs? Well, the best way to measure the signs for low back concerns is when we do all the objective tests that we do in our office here. And I'm going to just review those with you. Those of you that are in the practice, you already know those tests that we run. But the question still remains, where are you on this health continuum? If you have symptoms, you are here, right? even if you had, and now some people are going to use medications so they don't feel the symptoms anymore, but if it's medication dependent, you're actually still here. Even though you might feel like you're there, you're actually still there if you're medication dependent on those, right? So that's one question, is where do you fall right now on this continuum? But there's another question, which is what direction are you headed? Are you headed towards health or away from it? Some of you are moving in each direction, right? But at what velocity towards health or away from it are you moving? So there's a speed to it. There's a direction and there's a speed. And sometimes people are moving faster into this deterioration. And my first job is to slow that down and then turn the corner. And then we start to gain ground and we start to move in that other direction. So momentum is mass times velocity, right? It's a little physics in there for you. So when we understand the symptoms as body signals, they're alarms that tell us that we're moving away from health. The symptoms are an alarm telling us we're moving away from health. And it's going to go off. And then when we start moving back towards health, the alarms tend to quiet down. And, even way up at the healthy end, if you're way up here, you might get an alarm and just start going the wrong way. And you're at the other end. And then you just start moving back towards health and the alarm quiets down. So you might, be way up here. And now you have a car accident. You were healthy going into it, but you get a car accident. You're injured. So now you're in symptoms very quickly, right down here. But if you went into it with lots of robust health, chances are you're going to come out of it much faster. What if you were already even right here? Maybe there were signs that you didn't know, you didn't have any symptoms, and then you get into a car accident. Boom, you're here. But now you're not recovering up to here because you're going into it already with lower function. So we have to learn how to speak body. And that's that innate intelligence in our body is giving us communications. We have to learn how to interpret the body signals so we can make better decisions, which leads to better choices and behaviors. And the key to that is asking, what is your objective? Is it temporary symptom relief or is it regaining health and function? And the way that you think about this is going to organize your behaviors, which leads to your choices. So your belief system leads to your choices. And that leads to your outcomes, which means your results. So your behaviors matter, and your behaviors will actually empower you so you can take your health back with your choices and your behaviors. So again, now we're going to look at, again, this idea here of how does the nervous system work? Like when we're feeling a symptom of pain as a body signal, what does that tell us about what's happening in the nervous system? So I want you to just look at this. Here's a nerve right here. And this nerve is made up of some subnerves, I'm going to call them. So there are some nerves within the nerve fibers within the whole nerve. And each of these sections has a different job. Some of these nerve fibers are sensory nerves, and they are for, they're really to perceive hot and cold, pain. They're helping us with posture. So the sensory nerves are communicating information to the brain. And so the sensory nerves are carrying information that might perceive pain or hot or cold or posture, where our body is in space. We call that proprioception, positioning, those kinds of things, temperature, right? That's what the sensory nerve's job is. The autonomic nerves are in charge of controlling the organs, blood vessels, and glands. So controlling the sinuses, it's coming up on allergy season, controlling your energy, controlling your digestion, your breathing, and so on. The motor nerves are what are controlling the muscles. So you might have muscle weakness or spasms, you might have fatigue, you might have tightness, right? So the muscles are carrying messages the motor nerves are carrying messages to the muscles. The autonomic nerves are carrying messages to the organs. And the sensory nerves are carrying messages to the brain from the body, maybe from the organs, maybe from the muscles, maybe from the joints. Sensory nerves are carrying information to the brain. Okay, so they go in both directions and they have their own roles. So there are actually 9 families in all of the functions of nerves, but this is kind of a good way to look at it here. And there was a study done in 1921 that showed a 90% correlation between diseased organs in autopsies and subluxations. So all of these nerves are going to certain places in the body, and I'm going to show you that in a minute. And there was a correlation that when there was a subluxation at one place, the nerves that were controlling those organs, those organs had disease in them. So 90% of your nerves are doing things other than feeling pain. And yet, when is it that we finally start to look for help? Only when the pain nerves are firing. That's when we think, oh, I need some help here, right? But meanwhile, you could have loss of function in all of these other capacities as well. So remember, your nervous system is the master communication system in your body, and it literally is like a fuse box. So the brain sends the messages down the spinal cord and then out through the nerve roots to go to all the different organ systems. And we know what this map of the nervous system is like. So the nerves that come out of the low back, what are they in charge of? They're in charge of the bowels, the bladder, reproductive organs. Now, I find that sometimes there can be stress at the very top of the spine that's affecting the spinal cord, and that can actually impact low back pain way down here because it's affecting the spinal cord. The brainstem right here is also responsible for posture and where the body is in space, that kind of thing. And so if your posture is poor here, if you lost these, the tone of these extensor muscles that give you that good curve in your low back, if you lost that and you're finding yourself hunching all the time, that can be coming from the very top of the spine, the brainstem area. And so we have this wonderful this wonderful nervous system, central nervous system. The skull is the helmet that protects your brain. The spinal column is a suit of armor that protects your spinal cord. If it stays healthy and communication is optimal, then health is going to be optimal. And your body is talking to your brain, telling it what it needs, telling it how it needs to adapt. Your brain listens and responds and tells the body what to do. And this is how you stay healthy. This is how you function. This is how you heal. But what happens when your communication breaks down? In a company, in a factory, in a family, if communication breaks down, communication is everything, right? It starts to affect everything. So your nervous system is the communication network of your body. If you want a healthy body, you need a healthy nervous system. If you want a healthy nervous system, you need a healthy spine. And that's just the way it is. So how do we measure? If you can't feel it, how do we measure what's going on? So this, I'm just showing you right here, the fuse box, right? So the wires that come out of the fuse box or the circuit breaker are going to different rooms in the house. We know what the map is. We can look at it right on the door of the circuit breaker. It has the map of where what rooms in the house are being controlled, right? So when we have a circuit blown, it's like, oh yeah, you were running the dryer and the microwave and the hair dryer and the dehumidifier. Oh, and the sauna went on at the same time and it blew, right? And all the lights went out. Where did that happen? No, we can just go reset that circuit breaker, right? Is when overload happens. That's what subluxations are, when there's overload, right? Now, when we're measuring this, like if we were to measure the muscles along the spine here, right in through here, these muscles are going to be doing different things because that circuit is blown, and these muscles are going to be strapping this area down. So we might see a tension pattern in the muscles right in that area. Right? So this is a scan we do that measures the nerve supply to the muscles. It measures the motor nervous system. We have another scan we do that measures the autonomic system. So it shows us which nerves that are controlling the organs have dysfunction. And so that's the technology we use that shows us the signs of you losing function. Now, when we do, I want to just go back one piece here. When we do blow a circuit, we have a subluxation, the brain just starts to get less information from the body. We call that proprioception, a loss of proprioception. When the brain loses track of what's happening in the body, it says, wait, that's a problem if I don't know what's going on there. And so the brain actually goes into an overall stress response, global stress response, when it loses track of an area. And one of the ways that it perceives an area is through movement. When you move, that movement sends messages to the brain to tell the brain what's happening down there. If you strap a joint down and stop the movement, now the brain's not getting accurate signaling anymore, and it goes into a stress response. It's worried about that. Like all of you mamas that are on the call, or you papas in the call, when you had little kids, little toddlers, and you're at the fairgrounds and it's the you know, it's the August, it's fair days, and you got your kids with you, and all of a sudden in the middle of the crowd, suddenly, where's my kid? Where's my kid? And you go into a stress response over that. That's what's happening when the brain loses track of an area. It's like, where is it? What's going on down there? And so it goes into a stress response. So when we go into a stress response, what is it that's happening, right? Our blood pressure goes up, our heart rate goes up, our muscle tone goes up. We're getting ready to run or fight. Our digestion is going to be upset. In the beginning of a stress response, we might evacuate the system instantly, right? Speed up that digestion. But then after that, we're going to slow digestion way down, because now is not the time to be having lunch. Now you're trying to avoid being lunch, right? A tiger is chasing you, right? So digestion is going to slow down. Reproduction, sex drive, that's going to down regulate as well. Not a good time to make babies when the tiger is chasing you. Our serotonin levels are going to go down as well. Not a good time to be sleeping and relaxing. We're going to have increased sensory systems, hyper alert. And we're going to have fear and anxiety flooding the system, because we actually are in jeopardy if a tiger literally is chasing us, right? We will have an immune response that will be down-regulated. And so that down-regulation is because the immune system is an expensive system to run. So when a tiger's chasing us, we're going to put that on pause, waiting. In a few minutes, the tiger will be done chasing us, then we can upregulate that immune response. But right now, all resources need to go to musculoskeletal system to run or fight. Insulin sensitivity is going to be downregulated, because we actually don't want to be moving sugar out of the blood. We want to keep it in the blood, because we're going to be fueling those muscles instantly with that sugar. And the liver is actually going to create even more sugar to throw into the bloodstream in a stress response, so that we can get that blood sugar, which is the fuel for the muscles. We're going to have a decrease in our HDLs and an increase in the LDLs. So those are going to go upside down. The purpose of that is that the cholesterol and the LDLs, those are what we use to, they are produced when we're coping with stress, because we use them to create stress hormones. So we are in high production at this moment of manufacturing more stress hormones. So we use the cholesterol for that. Now we also use cholesterol to repair wounds, to knit that tissue back together. And so if we are on a low cholesterol diet, we're not going to have what we need if we have a wound to actually repair that wound. And so it's very important actually that we do have some, if a tiger is chasing us, right? Clotting factors are going to increase, because if we just get that wound instantly, we want it to clot right away to stop a bleed. So all of this is an adaptive physiology that is perfectly designed for when a tiger really is chasing you. Except that most of us have never encountered a tiger in our life, right? In fact, most of us have never had an actual life-threatening experience. I was sitting on my deck one day a couple of summers ago, and a bear literally showed up on my deck, walking around the corner, like, you know, about 20 feet away from me. Okay. I ran in the house, right? Fast. And that was like a ninja move, how fast I moved, right? That was that stress response. As soon as I'm in the house, I'm like, I'm safe. Where's my camera? I want to get a picture of this, right? So that was an appropriate, I readily and appropriately adapted to that situation, right? But most of the time, our stress responses are not coming from actual lions and tigers and bears. It's coming from our thoughts about our deadlines, or our worries about our relationships, or our work stress, or, you know, you name the list. You know more than, you know, for yourself, and more than I do what your stresses are. But we need a new premise here, because stress certainly is part of our life, but we need a new premise to think about, how are we going to address things if we have a symptom show up? How are we thinking about this? We need a new premise, because the only way we've been trained is to think, oh, a symptom, you need to stop that symptom. Where's the pill? That's what we've been trained. So instead, here's our premise. The premise is that healthy is normal. You know, so many people believe that symptoms are the best indicator of your level of health, but we need a better premise about that. Healthy is normal. Your body is smart. Your nervous system is the master system in your body that controls everything else. Your spine is your suit of armor that protects your spinal cord. And your modern life is unnaturally stressful, right? It's unnaturally stressful. All right. So how many people here feel like life just keeps getting more and more stressful. I thought it was already stressful. And then 2 years ago, wow, we broke the record on stress, right? In the last 2 years, right? All right. So, and who believes that life is probably going to be more stressful next year? I'm hoping not, but the way things are going, yeah, it just keeps going in that direction. So if we cannot control all of these external factors, what can we control? That's what we want to put our attention on. And let's just take inventory here. The sources of our stresses. They are thoughts, toxins, and traumas, and they both come in macro versions and micro versions. So those macro traumas are the events, the car accident, the sports injuries, right? Sledding and biking and all of those kinds of things. Work injuries might be another source of that. Slips and falls. Those are the things that, injure our low back. All of these things can injure our low back, jar our spine. These are the obvious physical stresses. They often cause pain and overt signs of damage, and they can be serious for sure, but they can also cause something that may not be so obvious. So all of these things can also cause subluxations. What else can cause subluxations? You don't have to get in a car accident to get subluxated. Does this look familiar, right? Whether it's raking or shoveling or gardening, right? That's the trend. That's the mode we're all in right now. But there are these other slips and falls that can happen as well. And there's the micro stresses, right? And this is even more likely for all of us, right? Right? There's that big guy in the small plane seat, right? There's the kid all hunched over, add a backpack to that, right? So it accumulates, all of this accumulates, and it's including our kids. How many people here feel like they spend way too much time sitting in front of the screens, especially the last 2 years? Holy smokes, right? It's a Zoom universe out there now, right? And even right now, we're on Zoom right now, right? Right? And how about your family? How about your kids, right? Amount of Zoom time, screen time for kids. So this is probably unhealthy in many ways, right? I'm sure you'll agree. But let's talk about one very serious way that this is causing a problem for you and your family. And we're going to talk about this as micro trauma. What shape is the spine supposed to be in? It's, an S shape from side to side. If you look at it from the side, we're supposed to have that forward curve in the neck and forward curve in the low back. Straight is strong from the front, right? Let's just do a little quick review of this. And then we'll come back. So, right. So looking at you from the front, straight is strong. From the side, we want to have forward at the neck, and we want to have forward at the lumbar spine, forward in the low back. Okay. That's what we want to have. And all that is sitting stacked right up on top of the sacrum. You can see how it all stacks right up on top. So we want to have those healthy curves in the spine. And if we have poor posture, and we're losing that curve, if we're looking down at our screens and our devices, if we are slumped over on our couch or in our chairs, or if we're bending over in our lumbar spine and we're not bending properly, right? Now we're actually going to be in trouble. And when we talked about the two most common areas of the spine that will have problems, we said that in the lumbar spine, it is that L5 disc that is going to have the most trouble because the whole brunt, the whole load of the body is right there. I will tell you the other most common place in the spine to have trouble is this C5 right here, because this is where the curve should be forward. We should have a forward curve there with give in it, and we lose that curve. And that C5 is the most common one in the neck. But that is another workshop. So all these micro traumas, they build, and our low back is what's taking the brunt of it. So let's go right back now to sharing my screen so we can stay right on track here. We're winding down. All right, so sitting is the new smoking. So sitting is a problem, and it's a big problem for your low back. And, sitting's the new smoking. I'd say screens are the new crack cocaine, right? If sitting's the new smoking. So, we're spending way too much time. The average American is spending 8 to 10 hours a day, 7 days a week now. And it's directly related to an increase in obesity, diabetes, heart disease, and statistically a shorter and sicker life. And to make matters worse, we're spending most of that time, again, in front of the screens. And this is what's leading to increased stress in our bodies in our modern life. This is the most common micro trauma, is sitting, and it's the biggest source of stress that people face today. So we all know that stress builds up and it causes subluxations. And so subluxations, again, are where there's the misalignment of the joint, the soft tissue damage, the inflammation, the nerve irritation, the muscle spasm and pain, lost inhibition, joint fixation. And that's from movement deficiency syndrome, right? Sounds pretty sophisticated. Movement deficiency syndrome. That's called being a couch potato, being too sedentary. And it creates a toxic global physiology as a result. All right. And so again, remembering that less than 10% of your nerves are sensing pain, the other 90% are running the function. So what do we do about all of this? Well, there are certain things that you want to stop doing. There's certain things you want to slow down and not do as much. And there's certain things that you want to start doing. And so I like to just equip you so you get your best results. And so I love this traffic light approach. And again, all this is in order to correct the problems, which is then going to end your back pain and prevent it from ever reoccurring again. I'm sure all of you want that. So it's a three-legged stool of correction model that we use. The adjustments in a rhythm are there to correct the alignment, the posture, the biomechanics, the structure, the neurology. That is the purpose of the adjustments in a rhythm. And I'm going to turn my page here. And then breaking the bad habits that are causing the subluxations over and over again. So those micro traumas that we talked about, how you eat, how you move, how you think, that's breaking the bad habits. And then exercise to strengthen the spine and strengthen the back. So when we talk about adjustments in a rhythm, remember, it's a corrective care is the kind of chiropractic that we do here. And so it's not just adjusting you so the pain goes away and then off you go and come back the next time the pain comes back. That's a different model. I have other colleagues that do that. That's not what we do in our office. We want to correct the cause of the problem. And that corrective care is so important. So rather than palliative chiropractic care, which is what I just described, or that's almost an allopathic model using chiropractic. But no, instead, what I mean is corrective care. It helps you, corrective care helps you get out of the fire. It corrects the cause and it helps you to stay there so that, and it's how we make that correction and live a healthier life that's important. So we have adjustments in a rhythm. What we want to do is we want to reset our healing rhythm. And over time, we want to build momentum and accumulate. And that healing effect accumulates over time. And it also acts as a hormonal reboot. So remember that stress physiology that occurs when we're subluxated. When we are getting adjusted, it reboots the system out of stress mode. And it does a little hormonal reboot in your system. So then you have the healthy hormones going through your body, like oxytocin for bonding and anandamide, which is the bliss hormone. Those are the hormones that you want to replace the cortisol with, which is the stress hormone. So sometimes people may have flare-ups, but if they're regular with their care, they correct more easily. And people that only get adjusted when they're flaring up, it gets harder and harder over time to correct those flare-ups. And they usually are going to have degenerative changes that's going to continue in between visits. When we look at the muscles, when we're resetting the segments that affect the muscles around the spine, then we want to do things to help these deep core muscles around each vertebra that are the rotators and the transverse muscles. We want to get these muscles to relax. And the more relaxed the nervous system is, the more relaxed the muscles are and the healthier the body is. So we use the surface EMG to measure that when we're doing our tests. If you have a sacroiliac instability, I use the sacroiliac belt right around the sacroiliac. So the belt is one around your hips, and it allows these muscles now to drop tension and to go into more ease. And also the back vitalizers, the jazz and the Equilicete, if you're using those actually position your spine in a healthier way. So that helps to bring more ease into the muscles. When you do your tush pull sit that I teach you, that exercise tush pull sit, that changes the positioning of the pelvis, which allows the muscles to drop tension. So there are different specific corrective exercises that I may give you when you're in care that are addressing specific dysfunctions, whether it's the sacroiliac, the disc, the lumbar curve. loss or stenosis. And so there's some specifics that I like to go into. For example, if you have the sacroiliac dysfunction, there's the windshield wiper exercise that you lie on your back and you just have your toes go in and out when you're lying on your back. If you do that right when you lay down in the bed before you go to sleep, it's going to just help to bring ease into the sacroiliac joints. And then in the morning, before you get weight bearing, just do that windshield wiper exercise with your feet again, maybe 20 times back and forth. And that primes the joints in the low back and gets the sacroiliac ready to be weight bearing. All right, now I also want to just go into a little bit more here when we talk about the exercises here. So which exercises to do and when. And again, I talked about the sacroiliac for the windshield wiper exercise. The lunge is really good for the psoas muscle if that's tight. Doing a lunge where one leg goes forward and the other leg stays back, that can help with that. So again, there's these, first we want to do a spinal assessment, and this is how we come up with the best answers to which exercises to do and when. We're going to do a spinal assessment first. A healthy body is going to carry itself in a balanced way. A very smart body is going to lean away from where there's a subluxation. So posturally, if the body's healthy, we're going to see it balanced. If there's subluxation, we may see a change in the posture. So part of our spinal assessment is going to look at the posture and postural imbalances and the differences on how we're carrying our weight. And then besides that, we'll use the instrumentation. Just like when you go to the dentist, if you have one tooth that's bothering you, the dentist is going to look at all of your teeth, right? And so when we're doing instrumentation, we're looking at all of your spine because we want to not just go to the area of the recent crisis or the area of trauma, but we want to make sure the whole spine is healthy. We're going to palpate and feel the spine. Tissue that's swollen, it feels kind of like a bruise on an apple, and we might feel tenderness in an area to identify that. Ranges of motion, we're going to check each movement of the spinal joint to feel how the disc is moving through range of motion. If there's swelling there, it's not going to move through the whole range of motion. So again, we're going to check the entire spine with that. The X-ray analysis is going to help us finding a problem. Well, you know, we can find a problem in the spine palpating, but then the X-ray actually helps to give us another dimension to that to make sense of things. And the scans also help us to make sense of things. And then we're going to be doing adjustments that are very specific in a certain direction, certain force. We're going to be training the tissues to get back into healthy alignment. That's going to restore motion, and that's going to then stop tearing up the tissues. And if it stays out of alignment, then there's no motion, the inflammation builds up, and we lose inhibition, so we can't heal. So the postural assessment is a good one to do. And if you have more than one person in your household, you can actually take turns doing a posture assessment. You know how we do it. You stand there with equal weight on both feet, looking straight ahead. You're going to close your eyes, nod your head up and down, and then have somebody look at what's happening to the posture. You know, is the shoulder tipped? Is the hip tipped? Are you leaning to one side or the other? Looking at you from the side. Again, you go up and down. And then where do you land? Is the center of the head over the center of the shoulders, over the center of the hips? Or is that head out in front, right? So that's going to be putting stress on the spine. So just doing postural assessments with each other is a way you can check that out. Now, again, these are the different criteria that we use to determine what actually is happening. And now we get to how do we address that? So flexibility is a key piece here. So warming up and cooling down before you go into any of the other strengthening types of exercises or cardiovascular exercise is key. And flexibility is an important thing. So stretching is just as important as strength training. We want to have flexibility. So squats are one of the best things to do for the low back for stretching. Squats are. And why is that important? It actually helps us to have healthy knees, hips, and back, and it keeps you strong and stable. And if you have a problem, it means you need to do it, right? If you don't have a problem, you still need to do it so you don't develop problems. So athletes, it'll bring athletes to the next level if they can really nail it with their squats. And if you omit it from your program, you're actually inviting a potential risk of injury and loss of strength, mobility, and flexibility in your life. If you look at people that live in the third world, they all squat all the time. They're squatting all the time. You go to their bus stops, there's no benches. They squat down while they're waiting for the bus. You look in their bathrooms and their toilets, they're pit toilets, right? They squat down for them. So yeah, Richard, you know about that in Asia, that's what they have. So third world countries, they do a lot more squatting and instead of sitting. So we do the sitting, but they do the squatting, and they have much healthier spines. Standing up from squatting should be a natural functional movement, and there should be functional training with it. It's inherently safe, and the body's going to reward you with big dividends. You want to be facing forward, and I'm going to show you an image of this here, right? So this is the best way to do a squat, and we do it naturally without even being trained. When we're a little toddler, we will do a perfect squat as a toddler. And so the features of this are that the head is in a neutral position, the torso is upright, we have a strong lumbar here, we have a crease at the hips that's below parallel. So here's the knee, parallel is here, so the hip is below parallel. We have the knees tracking over the toes, but not out in front of the toes. So that's an important piece there. The feet should be about shoulder width apart, and the weight is going to be resting on the heels. That's the proper way to do a squat. And so I want you to start training on your squats. In the beginning, you can just squat into a chair. Don't even try to go all the way down if you're not used to doing squats, but just try to do it pretty slowly. And in fact, if you do a super slow squat, you're going to work really hard doing that. And you're going to get a lot of benefit from just doing one super slow squat. And if you do a super slow squat down into a chair, and as soon as you come to the bottom of the chair, don't sit, don't actually put your weight down on it, but just tap it and immediately start to stand up again. And you're going to be doing a lot of work, especially the slower you do it, the more work it is. So when we think of core strengthening, I just want you to see there's two different levels to this. So level 1 core strengthening and level 2 core strengthening. Level 1 core strengthening is going to be in your standing posture. It's doing your inner corset exercise. So let me actually take my screen share off so I can just show you a few of these things and remind you about these. So for the I'm just going to look at my notes here so I can keep on track without that in front of me. Standing posture, so the inner corset. So the inner corset, remember, is where you're going to put your arms up over your head as though you're carrying a laundry basket with the palms up. And what that does is it lifts everything up in the torso. Then you're going to keep everything lifted, and you're going to stand and you're going to take your tailbone, you're going to lift it up and back. When you push it back behind you, you'll feel the weight drive into your heels, off of your toes onto your heels. And then you're going to take your ribs and just tighten them down 1 millimeter. It's a tiny little movement. And now you've got your inner corset all the way around. So whenever you're standing, you just want to keep coming back to your inner corset. Now, this sensation that you have of your inner corset, it is the same sensation you should have if you were doing a plank. And a plank is the one that you're on the floor. Maybe you're on your elbows and your feet are stretched out behind you and your torso is at an angle. So here's the floor, here's your feet, here's your torso coming up, and then your elbows are right here, right? So that's what a plank is. You can literally start by doing your plank up against a wall if you don't feel like you're strong enough to do it all the way down on the floor. So you can just lean against the wall, right? With your elbows, you can just lean with your body straight, and you're just going to tighten that whole inner corset up. And then you can just lean and go further and further away from the wall until you're ready to now go. Maybe you could go on a table. You could lean onto a table instead of all the way down onto the floor. You could use a physio ball, one of those therapy balls, those big balls. You can lean on that with your elbows, and that's kind of unstable, which actually puts more demand on you. So that's a bit more advanced, is to do that. So the level 1 core strengthening, that's going to be just doing that plank in a stationary position. The foundation training I may have introduced you to, that's Dr. Eric Goodman's work. And this is where you're learning how to bend. So again, remember with the foundation training, you're going to stretch forward, with your arms as you're pushing back with your bottom. And so that's that founder exercise. And you're going to do all kinds of movements where you're stretching the arms out in front of you and so on. So Dr. Eric Goodman's foundation training exercises. And then for sacral iliac, I will have given you 3 levels of that. The first level is the one where you're on your back and and you're just crossing your knee. You're crossing your knee over to your shoulder, right? On either side, pulling it up on either side. Another one is when you're lying on your back with your shoulders out to the side and you're twisting to the side. So that actually helps with the piriformis on either side. And then the second level of that is the lunges. So the lunges are when you are putting one leg out in front of you and stretching one leg back behind you. So you feel stretch right through here. So that's the lunge on either side. Remember that you can always do a seated lunge. So you're sitting on the edge of a chair and just put like if you're sitting on the right hand edge of the chair, you'll put your right leg back behind you. That's another way to do a modified lunge. If you have trouble with your knees or you're just not feeling stable. So you can sit in a chair and do that lunge and then you just turn the other way and do the other side. So the lunge is key. And then the last one for the sacral exercise is when you're lying on your belly and you lift up your head and your arms and you lift up your feet. So it's like a Superman posture. And that is really strengthening the whole posterior chain, kinetic chain. Okay, so that's the level 1 core strengthening exercises. The level 2, I'm going to bring back my screen share here. The level 2 is when we are taking it to the next level. So plank on the move, like on a physio ball, when you're doing your plank on a physio ball, and maybe you're tracing a figure 8, or I like to do the alphabet or spell my name, A, B, C, right? And so when you're doing that plank on the move, or you're on your elbows on the floor, and then you do a lift up towards one side, and then you do a lift up on the other side. So those are some ways to do a plank on the move using the physio ball. You could go do CrossFit training. You can do Pilates. You can do yoga. So those are all second level core strengthening. Okay, and then so here again, it's stopping the bad habits. It is on how you eat, how you move, and how you think. So when we talk about breaking the bad habits, it's all about eating, moving, and thinking. So we want to eat well, move well, and think well. And so if we think about our health as though it's a bonfire, we need 3 things in order to have a bonfire. We need fuel, air, and spark. Fuel is how you eat, air is how you move, spark is how you think. So everybody wants better health. Everybody wants a bigger bonfire. You have to have all 3. You can't, like if you have a pile of wood and you have a nice breeze and you have no spark, you have no fire. So, pile of wood, that's the fuel. If you're eating really well and you're moving, but you have toxic thoughts, right? You're not going to be healthy, the level of health that you want. If you meditate all the time, but you never exercise and you eat well, you still haven't hit it. How about the people that are exercising like crazy and think they can eat whatever they want because they're going to burn it off, right? And they're eating all those inflammatory foods, right? So that's not going to hit it either. So we have to do all 3 at the same time, over time. That's how we're going to get our best results, is having these be habits. It's the habitual accumulation of the bad habits that gets us into trouble. And it's the habitual accumulation of the good habits that pushes us in the right direction. Let's see. I just want to look at my notes to see if there's any more pieces here. So when we talk about how we eat, the key things to remember are anti-inflammatory diet, asking yourself in every meal, where's the protein, where's the healthy protein, where's the healthy fat, and where are the healthy plants? So plants, proteins, and fats are what you want to see in every meal. Fish oil is a really important healthy fat that everybody needs to have in their diet because it lowers inflammation. So this is specifically, we're talking about low back concerns. everybody that has a low back concern needs to be on fish oil because it's going to lower that inflammation. Okay, when we talk about how you move, people have tried exercising, but they keep re-injuring themselves. And so they stop exercising. That's a problem. So we have to get your spine healthier first. And then we have to teach you the healthy ways to start increasing your exercise. So it's going to be doing your spinal exercises first. And then that gets it so it's safe for you to go and do more robust exercise. But just like if you get a cavity, you're not going to stop eating food if you get a cavity, right? So you don't want to stop exercising just because you have a subluxation, right? And so it just means we have to be eating the right things. So if you have a cavity, it's not that you stop eating food, it's that you should stop eating sugar, right? That's what it tells us. So we need to do the right thing. Less sugar, more brushing is the answer to that. So low back pain doesn't mean to stop all exercise or sitting. It does mean to do the right exercises at the right time and to sit the right way for the right amount of time. So you really want to keep an eye on that sitting. Every 30 minutes, you want to move around a little bit. Otherwise, that's a bad habit that builds up. For movement, also, we want to look at specific exercises. So there's general exercise, and then there's the specific exercises. So general exercise is kind of like moving your body, getting your steps in every day, getting some burst exertion exercise in every day so you have panting and sweating. But then the specific exercises are things like the tush pull sit, the back vitalizer, the physio ball, the inner corset, lengthening when you go down, when you go to sleep. People ask very much in this movement category, how should I sleep? What's the best way to sleep? And so with low back problems, yeah, you don't want to be sleeping on your belly. That's going to get you into trouble. So I find that oftentimes people with back problems, they'll tend to actually go into a fetal posture more often than not. So preparing your spine for sleep is key. So doing your rotational movements back and forth 20 times, getting the discs more malleable, rolling up the towels, putting them underneath your neck and underneath your low back, laying on those towels for 20 minutes before you go to sleep. That's the correct way to prepare the spine for sleep. And I also like that I encourage people, if they tend to be a fetal position sleeper, to actually consider lying on your side in your bed with your body as straight and long as possible. So instead of people think, oh, I'm going to get all cozy and go to sleep, and they go into fetal positioning, I want you to think about what is it like if you were to just completely lengthen your spine on your side in your bed, right? I want you to get that experience. It's an amazing feeling to just stretch your body out straight, like legs completely straight on your side, and just hang out there for a little while before you go to sleep and see what that feels like. I think it's a good way to help to turn the stress switch off. Now, also there's the functional movements. So really training your movements, not your muscles. That's the key for training for life. So having a good technique, so that you're actually in good shape when you need to be in shape. And then we get into that's how you eat, how you move, and then how you think. So enough rest and downtime is key. Sleeping more than 5.5 hours and up to 7 hours is when most healing occurs. So I just want you to get that. When we go to sleep, if we're going to repair damaged tissue, the most healing of damaged tissue happens after 5.5 hours of sleep up to 7 hours of sleep. So if you go to bed and wake up and then you're lying there awake and then you go back to sleep again, now when you go back to sleep again, it's actually another 5.5 hours in to get to that good healing range. So that continuous sleep for a good 7 hours, the most valuable time for healing tissue is in that last hour and a half, that last 90 minutes of 7 hours. That's for repairing cells and renewing. And sleep is what helps you to rejuvenate, but taking time to do things you like is another way to recharge your batteries. The most common time that people get disc injuries is during divorces or for men when they're financially stressed. That's the most common time when disc injuries happen. Sacroiliac instabilities often happen when we're not feeling supported. So that's the how you think part. So having mindful movements and paying attention to our body signals, breathing into an area when it's talking to you, asking that part of your body, what are you trying to tell me right now? That's the way to have healthy thoughts around it, around how you think. All right, so just as a recap, adjustments in a rhythm, breaking the bad habits, and doing the spinal exercises to strengthen the spine so that you can bulletproof your spine and live into your bigger and bigger life as you get healthier and healthier. I'm going to stop the share right now. I'm going to stop the recording right now. And I want to just take a quick look at the chat as well and see if there are questions. So there are some questions here. Hang on for a second. Yeah, I'm glad that you folks that had to leave early. I get it. So I'm glad that you were on when you were. But let me just stop the recording here so that we can then answer some questions.